So hello, everyone. It's a different face today. I'm replacing Erica. My name is Diane Kite. I'm a project officer and senior wellness initiative coordinator at ECOL, the English community organization of La Naudière. I will be your facilitator for today's session. We have two wonderful speakers with us today to talk about alternative living arrangements for aging in the community. Jen Recknagel is the Director of Innovation and Design at NORC Innovation Center at the University Health Network. She combines expertise in human-centered design and systems thinking to tackle challenges at the intersection of health and its social determinants. With a strong background in integrating participatory and community-led approaches, she is currently leading an innovation program aimed at reimagining support structures for aging in place, emphasizing older adult leadership and improved access to health and social care. We also will have Janet Torge, who is the founder of Resthomes and is a documentary producer, speaker, and facilitator. Her background is in media, CFCF talk show host, CBC reporter, Radio Noon animator, and CBC traffic lady. For the last 30-some years, she has worked with Josh Freed as the producer of his documentaries. When she was much younger and visiting her aunts and parents in residences, she vowed to make sure there were choices other than senior residences for those of us who wanted something different. So I'm going to hand it over to Jen. Welcome.
Thank you. Thank you so much. So happy to be here with you all. Happy to be here with Janet. So excited to hear more about the Radical Rest Homes. I'm just going to share my screen, and I'm with a group that's called the NORC Innovation Center at UHN. UHN stands for the University Health Network. It's actually Canada's largest research hospital system, and it's comprised of Toronto General Hospital, Toronto Western Hospital, Toronto Rehab Hospital, Princess Margaret Hospital, the Michener Institute for Learning and Education. So, at the NORC Innovation Center, I've started this work, and we started this work almost 10 years ago, knowing that just looking at demographic changes, that there's, going to be a whole lot of older adults who want to age at home and want to remain out of institutions. So we really started our work thinking about, how might we think expansively about aging in place? And how might we address the diverse needs of older adults to stay healthy and independent, while trying to create and while thriving in place with full and enriched lives. And, I always say I started this work by doing, it's interesting because Janet, I also have background in documentary film. So I always say I started this work by doing more journalistic style of research, where I went around and started asking people who were doing work with older adults in the healthcare system and said, what are some of the things that you're seeing that you think is really innovative in terms of how we might support older adults to have a better experience and stay healthy? And so I heard about many things. And, as you may or may not know, we have wonderful people working in the healthcare system who are constantly seeing need and looking for new solutions. Many of those things don't get published in official studies because they simply don't have the time or resources to do this. So you hear about things when you just ask questions. And it led me to a woman named Christine McMillan, who started one of Canada's first NORC programs in Kingston, Ontario. And I said, wow, this is really different. And so I'll share more about what NORC programs are. But just to say that, really this work and thinking about aging in place has been going on for some time. What we heard next was started to ask folks in the community who were actively building their own solutions to how they could remain at home and grow old together, what they thought the key ingredients are to aging in place. And we heard about things like health and well-being, and I'm sure that's echoed in the poll that we did there, social support, especially as mobility decreases and social networks change over time, that having that sense of social inclusion is so important. We're seeing a lot of studies about the impact on our health from being socially isolated. We hear a lot about help with everyday things. You know, our publicly funded home care system, it does personal support. So it will help you with bathing and dressing and this kinds of things when the time comes, but they're not going to help you change the light bulb, which you might try to do on your own and then fall down and break a hip, or, you know, get the garbage out or open the jar. Like you might still be able to cook, but your arthritis is bad. You can't open the jar. So these things with like these small things are really, we heard, key ingredients to remaining at home and independent. And they often fall to our informal support network, adult children, neighbors, friends. We heard a lot about information and navigation. I don't know if it's the same in Quebec, but I suspect it is, that there's so much to learn about what's available, whether you have access to it, whether you're eligible, just finding out information about what is available for you is a hard work. And especially as more and more things are online, you can't get an actual person on the phone. Support for older adults with just knowing where to go and what you can get and what's available is really key to remaining at home and feeling healthy at home. The last two are a little bit different, but I think are key, are really important. And so we heard a lot about the need for self-determination and choice. A lot of people said, I don't want to go the way that my parents did and end up in an institution where I have little control over my day, around what I eat, around what's available. This sense of to live, to remain an active citizen in the world, to have a sense of self-determination and choice over my day and how I spend it, is really, really important for this new cohort of older adults. And then the last one is, I think, true for all of us really, but having a sense of purpose, of having something to participate in that you belong to, is really important for those who want to age in place. I think that there's an old and perhaps outdated notion that people want to just retire and be entertained. Somebody said to me, I don't want to just be entertained to death. You know, I want to be an active and engaged citizen. I want to be part of the world and I want to have something to do that's important to me. And that helps me have a sense of purpose and meaning and generate the sense of vitality needed to remain at home when it becomes more difficult and there's more pain. And so these things, we took these things away and said, okay, what can we do to support these requests? So with all of this, we started looking, you know, more broadly then at aging in place trends across the country. And we learned that older adults are the fastest growing segment of the population, and that many are living longer than ever before. Interestingly, many are also choosing to move into urban areas and are choosing to live in high-rise buildings. So in our major urban centers, so in Toronto, 36% of older adults who live alone or who live independently live in high-rise buildings. And there's similar trends in high-density living happening across our major urban centers. You know, we started looking at these buildings and we started mapping them. So these buildings that have a naturally high density of older adults can be referred to as naturally occurring retirement communities, or NORC for short. And so these are not retirement homes, they're not long-term care. They are not purpose-built for older adults. They are regular apartments, condos, co-ops that happen to have 30% or more adults over the age of 65 living there. And some have like 40, 50, 60% of the building is over the age of 65. And so this map here that you see is a map of Toronto. And you can see that in Toronto alone, there are almost 500 buildings that qualify as a NORC, and that represents 70,000 seniors. The chart on the bottom will show you that there's actually more older adults living in NORC buildings across the province than in long-term care and retirement homes combined. And so when you look at that we're from the health system and you say, we're used to delivering care like in a one-to-one and we're meeting people all over the place to help, give services. How can we look at naturally high density pockets and start to deliver services and support right to where older adults live and where they want to stay? And so, to do this, first you identify NORCs, which is really just a geographic designation that just so happens to have a lot of older adults. Doesn't mean anything is happening there. People are just living. The idea of bringing services to these NORC clusters are called NORC programs. And so we are at the NORC Innovation Center developing NORC programs to bring services and supports to older adults living in these high density clusters. It's really important to say, though, at this point that there's currently no, in Ontario and across Canada, there's no government funding for NORC programs. So all of this work has led to the development of our center, the NORC Innovation Center, which has really been developed through a mix of philanthropic support and competitive grants. And our goal is to develop an integrated model of health and social care for NORCs to better align with this high density future. And our model really places an emphasis on older adult leadership and participatory decision making. And so we have been active for only 2.5 years, and we're really still in a learning phase of our development. And our aim is to understand how NORC programs can benefit older adults to age in place, healthy at home, across different contexts. So whether it's different types of buildings, big buildings, small buildings, buildings in like the urban center, buildings in the inner suburbs, different socioeconomic contexts, different types of buildings, condos, apartments, co-ops. So we really are trying to understand how can we design a model that can be supportive across different contexts. And so currently we're in 23 buildings in Toronto, piloting 2 different program formats and reaching almost 3,800 older adults. At the heart of our program, just at a very high level, we're looking at aging in place holistically. So from prevention and promotion for those that want to stay healthy, and the majority of people who are living in the community and living in NORCs, for the most part, are independent and fairly healthy. So how do we help those folks stay healthy and do the things they need to that will be supportive of aging in the community? And that could be from support with information and navigation to health promotion, health education events. And then for those that may be needing a higher level of support or potentially are falling through the cracks who have higher needs, we're working on helping to facilitate, connect, and refer them into services that they might need. So each NORC program that we're doing in our 23 buildings is based on the interests and needs of residents at each location. And our goal is really to look at what is available in the system and pull it into the NORC building. So we're a bit of a connector in that way. At the heart of what we're doing is working with older adults and local residents, often older adults, who are interested in turning their high-rise building into a NORC, a vibrant, mutually supportive, aging in place network. So in this sense, we're looking at how to partner with residents to activate an aging in place network of support to help with those little things, to grow local leadership from residents on the ground, and to help develop a network of support. We work with residents, about 4 to 5 residents who become NORC ambassadors, and they're the primary agents on the ground who are helping to develop a community of support. We work with them through monthly meetings that follow a structured curriculum, and that we also work to bring place-based services and supports right to where they are. So how our program works is that we see ourselves in this sort of 4 C's capacity. We're the catalyst, that is the spark that brings residents together around this idea of, we all want to remain at home, we all live in this building, we want to stay here. How do we start transforming our community into a place that will be supportive of continued living at home? We then do capacity building with local residents through the NORC Ambassador Program to support them in learning how to mobilize community, how to do outreach, how to listen deeply. A lot of conversations around what does it mean to be a good neighbor, and where are the boundaries of that. The ambassadors themselves talk a lot about, we are looking out for one another. We're not looking after one another. This isn't a place where, you are then now responsible for your neighbors, but you are somebody, hopefully, that can, be like a friendly face, a warm hello. This can mean a lot to, there's a new physiotherapist down the street who's wonderful, kind of thing. We're connectors. So at the same time as growing this network of support in the building and doing that community development work, we're also listening to the needs and preferences of residents and linking them with the formal health and social care system. So if residents in the building say, we're really concerned about falls, we'll look for a provider who can bring a falls prevention program right to the community. And that could involve exercise program, it could involve education, pendants, this kind of thing. So we really are being that connection point between a group of residents and the formal system. And then we provide ongoing coaching. So, if you have something that's a resident-led, citizen-led initiative, there's going to be issues of burnout, of, how do you sustain these efforts? And so we do provide ongoing support and tools to help, and resources to help sustain these initiatives. We also have the second program model that I mentioned, is a higher intensity model, where on top of this work we're doing to build an aging in place network with residents, our higher intensity model has a staff person in the building, and they can support residents to organize programs and activities with information and navigation. Most importantly, they're there to form relationships with residents who might feel more comfortable disclosing concerns with a neutral third party. But importantly, that person can also refer them into the one-on-one support network, which is on the right side. So this is our virtual nurse practitioner-led care hub, where if a resident, say, for example, doesn't have a physician, or is having trouble managing their diabetes, they can get referred in to our integrated care lead. There's a full assessment that's done looking at their health, their well-being, their social needs. They will then connect with their family doctor and figure out what they can do, what they can refer them into to get the support they need. So those are the 2 program models we're piloting. As I said, we're fairly new. We've just been up and running for a couple years now. And there's some interesting lessons learned that I thought I'd share with this community here. As I think it's more interested in, what can residents do to facilitate aging in place in their own communities. And I think some of the big lessons that we've learned are that it really does take, time. Community builds at the speed of trust. I think somebody said, somebody famous, certainly not I, And so for us, starting slow and really building those relationships, taking time to listen to your neighbors about what's important to them, what kind of community they want to build together to remain, at home for as long as possible. To do that work and to start slowly will then help you go fast later down the line. That's what we've learned. We've been taking a very relationship-based approach, in the sense of like working to build connections with one another before just developing and jumping to solutions. I think sometimes when we have volunteer-led, although this happens in the work world all the time, we don't necessarily take the time to listen and to learn about others' needs and experiences, rather than we make assumptions and then we just decide what we think is best. And so it's really important to model this for the community, to listen to what people want, and then to build the solutions that integrate that. And in doing that, you'll get better ideas that people will want to join because they feel heard and they see themselves reflected in what's being created. That I think, the reality is that the healthcare system has some supports that they can provide, but there is definitely a gap in terms of what's available. And as mentioned before, a lot falls to the informal network of support. And so I think one of the big ideas in building that aging in place community network is, how do you look at what is available and what is strong in your community and what the individuals in your community might have to contribute to building something, is the better place to look, rather than, oh, we don't have this, we don't have that, like at that deficit-based approach. We talk about it as everyone has a superpower. Some people really like to be the host and convene, and other people hate that and would prefer doing like background work to help organize things. Or some people are more comfortable like getting the food ready, or reaching. Some people really like the work of trying to reach out to the local Heart and Stroke Foundation to come do a talk on strokes. Everyone kind of has a role to play, and we recognize that. I think, building in time and space to reflect together on what's working and what's not working, and having honest conversations. That's what we've heard from ambassadors as being really, really important. And then celebration. I think a lot of us aren't really good at celebrating all of our accomplishments and what we're doing, but it's really important in these, in terms of building a network of support, to really recognize people who've been putting in time, the big accomplishments, the small accomplishments, and that the skills and wisdom that are in that community who are coming together is, something worth really acknowledging and celebrating. And in doing so, you'll help generate more support for an ongoing network. So I think this is sort of towards the end. I'll just say that this is one of our ambassadors on the left and one of our staff coordinators on the right, and they were at an event listening to the community. So you can see some of the notes there on the back. And, she said the strength of this NORC program idea, the UHN NORC program, is that we really are driven from the bottom up. And that this is the best way to allow for different and new ideas to emerge. That working together with community, not coming in as service providers who, just tell you what we have to offer. We really do a lot of listening to what people want and need, is really being reflected from residents as valuable. In terms of some of the great things that people are doing in their aging in place networks, some residents have started looking at, say they're going to have a talk or an event and are offering to be walking escorts to bring those who may be having accessibility or mobility challenges, walking them down, helping them with their wheelchair so that they can actually get there and participate. That's a huge thing. Another story are these buddy systems that I think a lot of neighbors start doing with one another, which is, one form of is texting each other every morning, just to say good morning and nothing else. I think a lot of folks have a fear of dying alone and not being found for days. And so they've set up these sort of buddy security systems where they just text one another good morning, and there's not an expectation of a conversation. You don't have to listen to each other go on and on and on. It's just good morning, there you go. And so one story is that a resident had done this, and when she checked, that the fellow didn't write back, and it turns out that he was in the hospital, and he had given her permission to call his family to make them aware. And so it's like building that network of support that can help just make things a lot smoother. From our staff model and the integration with the system, there was a resident who had diabetes, and she was referred into our virtual care hub for diabetes education and support with self-management. And so they had a joint visit with the nurse practitioner, and they did a full assessment. And after they did the assessment, it was surfaced that this woman had several needs beyond managing her diabetes, including poorly controlled asthma. She also didn't have primary care. So our hub was able to connect her with the local community health center, who would be able to get her into a primary care provider in 3 months' time, which is pretty fantastic, considering wait times. And in the interim, our nurse practitioner was able to support them until that time to manage their diabetes. There also, with the asthma, there was an upcoming group session in the building that they were able to refer her into to get that ongoing support. So that's just an example of how we see the NORC program working to support residents to age in place right where they live. I'm sure I've gone over way too much time, but I just wanted to show this group. I think it's in the resources that you'll get, but we built a website for our NORC ambassadors called norcambassadors.com. And on it, there's a do-it-yourself guide that helps interested residents who want to organize and form an aging in place community on the steps to how to do that. And so we have quite a few DIYers in Toronto who have been using this guide and have been having, really doing wonderful things in their own community. So I just wanted to share that resource with you. On it, there's also this thing called the Idea Bank. I think there's almost 70 small community activation ideas, just to kind of spark your imagination. We've often found that it doesn't totally matter what you're doing. Like you could have a book club or a walking club, but there's all these other creative things that you might do that have to do with food or civic engagement or lifelong learning that can help bring people together, bring them into relationship and starting to form that network of support. It happens slowly. First, it might just be a hello or a wave. And then next time, maybe you stop and you have a little chat. And then, over time, there's this support structure. Could you pick that up at the store? Can you help me with this? This kind of thing can build over time. And, certainly we all wish that the healthcare system could provide us with all the support we need. But the reality is there is a lot of, already there's issues with not necessarily getting the amount of support we want and need, and a lot falling to the informal networks. So part of this work is looking at how we can work together with communities to build an aging in place network of support, and to look at how do we rally services to bring them right into the building. I don't know if there's an official NORC program in Quebec. I don't think there's many things that are very adjacent to NORC programs. The idea of bringing support to where people live is not, this is something that's happening. I think what's new about what we're doing is that we've been taking a data-driven approach and saying, where are there clusters where people already live? So you're not moving anywhere. You're just bringing services them. And then you're also supporting them to start their own informal network of support. And I think that becomes really important when we look at, already the crunch in the healthcare system around the amount of home care hours, around not having enough healthcare human labor, available. Like what can we do in our communities? And I think by doing that, it also gives that sense of like, I'm building my own retirement community. I'm in charge. Like we can make it what we want. And, if there's a way to partner with the formal health system to support those efforts, that's certainly what we're trying to do in Toronto. Being from UHN, Canada's largest research hospital, we have a lot of opportunity to pull in what we're doing at UHN and bring it into the community, as well as work with other health and social service providers who have the mandate to support older adults in community, but maybe don't know how to reach these clusters. So anyway,
I think here in Quebec, we share a lot of the same issues, and what you brought up, I think a lot of people can identify with. So we will be moving on. Thank you, Jen. But I would like to introduce Janet Torge, the founder of Radical Resthomes, and she will be presenting on something which is I think more based closer to home in Montreal. So you can take it over, Janet.
Hi there.
Hi.
Okay, we're going to go from big to small here. Okay. Radical Rest Homes is a small little NORC that you create yourself, if you want to think of it that way. Okay, so I'm doing a thing called Radical Rest Homes. I've been organizing this for quite a long time. It's kind of based on the idea of back in the 60s and 70s of communes, when we lived together for affordable housing, really, and support. So that's basically the idea of it. The idea is that many seniors now want a new last chapter. Like these kind of images are not what we're looking for. And I think during the pandemic, that was really clear to everybody that that going into institutions and that sort of thing just doesn't work. Or it may work, but we don't like how it works and don't want to be there. So what is a real housing alternative for seniors? So these are the things that we've come up with. It could be small group community living, not institutional or isolating. This is the idea. There is, even if you're in your apartment by yourself, there is an isolating feeling about that. And I've had it. Like, I've lived with people my whole life. I'm now living alone. And you know what? My evenings, I mean, there's way too much TV going on in this household. And so it's like, we need some kind of, we need more contact with people. As we get older, we need more sort of social stuff going on. We also need contact with people of all ages. This is one of the things that I think is a failure of institutional living, is that you're only stuck with seniors around you. And when that happens, I mean, as we get older, we get a little slower. And I notice when I go into senior residences, the minute I walk through the door, I start walking more slowly. There's an atmosphere, there's a feeling there. We also, just like in NORCs, residents need to support each other with the help of friends, family, and the medical world. If you're living in a small group of 6 or 7 of you are renting a house together, then your support group has expanded really a lot. Like, you have the kids of all the people there, you've got the aunts and the uncles. So your support group really expands. And you can also, as a group, look for care that emphasizes quality of life and not just treatment. And of course, the biggest thing now with the housing crisis that's going on is living in small groups is highly affordable. when we looked at some of the, we're really lucky here in Quebec because we've got all these large houses that are left over from big Catholic families. And when we looked at renting some of them, the rents were like, for 6 bedrooms, it was $5,000 a month. So you're looking at your rent coming really, really down and being affordable, which doesn't often happen these days. During the pandemic, when we were all stuck at home, like not knowing what to do, I sort of got a research grant and went on Zoom and went all over the world looking at different kinds of alternative housing for seniors. And I actually found a movement. There were all different kinds of different housing ideas coming up, co-housing, just sharing with friends, like the NORCs, anyway, all different kinds. And I talked to a lot of these people. One of the things that I found out is that 90% of the alternative housing for seniors, that's like co-living and that sort of thing, you need equity to get into it. This is not a NORC. These are the ones where it's new construction, they put it together and it's seniors and families all living together, which is wonderful, but you need equity. And so that was one of the things that I said, there's got to be some kind of alternative living for people that don't have equity, who are just renters. And that's one of the things that makes Radical Resthomes a unique idea. We're going to use existing buildings in vibrant neighborhoods, so you don't have to go out to Hellengone where the residents are. It's co-living rentals, although it could have some equity tenants, which would make it even more affordable. Small groups would live together in a comfy atmosphere. The other thing that we came up with, houses with purpose, so that the people who live together are not just like any old seniors. They're seniors who share interests, or backgrounds. For instance, you might have a group of 5 senior artists living together. You might have 5 seniors who all had their own businesses, and that's the kind of thing that they're interested in, so that they share their values and their interests. We also, when I did a survey a couple of years ago and asked people, if it wasn't just seniors, if you wanted to have some other people live with you, what would you want? And they came up with ideas that I had never even thought of. A lot of people, the big one was that they wanted to live with an immigrant family. So there would be 3 or 4 people and an immigrant family living together. The seniors would help the immigrant family adapt to what's going on and help with the kids and that sort of thing. There was also the idea of student mentorships, which is that if it was 5 seniors living together who all had owned businesses, they could have a young student who was going into business live with them, and there would be this mentor thing. The thing I like the best about that kind of multi-generational living is that residents change in these houses for positive reasons. If you only have seniors living together, then you have to, somebody dies and they move out. It's like, oh my God, or they have to leave because they go to the hospital. Whereas if you have other kinds of people staying there, younger people who are moving on in their lives, the residents are changing for positive reasons, which I thought was one of a really good facet. And the other thing is that Radical Resthomes are affordable for all tenants because you're splitting everything. You're splitting the food, you're splitting the care, you're splitting the rent. But there are barriers to innovative housing ideas, and I've learned these over the years. I think this is my 13th year with my bandwagon out trying to get this thing off the ground. And here are the barriers that I see. Senior housing developers want control of the market share. There's no question about that. government is partial to big, look what we've done, new projects. So, when they say, okay, we're going to do this for you, it has to be big and something like that. Affordable housing is not profitable or even interesting to investors because it isn't profitable. It's just affordable rent. It's great for housing statistics, but it's not great for the people who own the properties. And the government sees this tsunami of seniors coming down the road, and they have decided that we need large institutional housing solutions, which of course many of us do not want. So, but there are things that are working in our favor. One is that the pandemic really did show the flaws in the present system. I mean, the number of people that died, the being blocked out and not being able to visit loved ones, I mean, it was just a travesty. And affordable housing is finally a big concern. So when you come up with an idea that makes it really affordable, not 20% less than the marketplace, but actually affordable, it suddenly becomes something that people are looking at. And the other one that I talk about every time I speak with government people is that the new generation of seniors are not compliant. I keep telling them, you do not want us in your residence because we don't just take stuff. Like we get mad and we want to change things. And it's not going to be as easy for you as maybe our parents' generation. I remember talking to my father about this. And he said, well, there's no point in arguing with them. No, it's not going to change. Well, the new generation of seniors, they don't take that into account. If they're going to change something, they're going to say something about it. So what is there left for us to do? We did a research report where I put down all the things that we learned from the people across actually around the world who were doing innovative things. And we have to incorporate promising practices in whatever one we're doing, like the NORCs, like Radical Resthomes. It's people first and group solidarity and support. We are now launching a compatible workshop for people ready to move because we're not naive. You can't, like the institutions that have seniors where you just go in. I mean, seniors have all different kinds of personalities. We're not all the same at all. And so we need, if we're going to have 5 or 6 seniors to live together, then we need to find out who's compatible. But it is so important because as we get older, I know, like, my personality is my personality. It is not going to change. It's rock solid now. And that's the same for almost all seniors. And I can't live with everybody. Like I have my own little things that I do, and they have their things that they do. And so, but it's important to recognize that that is an issue. One of the things, just a little story, when I was talking all around the world to different innovative places, I ended up talking to this woman in Australia. And she is doing the same thing that I'm doing. It's not a radical rest homes, but it's putting 5 or 6 seniors together to live together. And she said, how are you going to choose the people who live together? And I said, well, I've made up this questionnaire, and it's not a multiple choice. You have to talk about how you would live with someone. What are your hours? How many people come to visit you? Blah, 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 all that kind of stuff. She said, and so what are you going to do? You're going to give that out? I said, yeah. And she says, and then you'll get them back. And who decides who lives together? And I said, well, I'll read them all and figure out what a compatible group is. She said, okay, great. And if it doesn't work out, whose fault is it? And I went, oh my God, it would be my fault. So she had dealt with this before. And so what we've done at Radical Rest Homes is that I have a 10-week workshop in which every week we deal with living together issues. And you listen to people around the table and what they have to say about how they do this and how they do that. And then you find your five. So the group makes itself up. So we're launching this summer, this spring and summer, a compatibility workshop for people who are interested and ready to move. We're also partnering with other innovative projects who have similar challenges so that we can come together as a group, not just one project. And we also have decided to focus on renting a big house instead of buying a property, because the buying of the property, there were so many hills we had to conquer. It just wasn't worth it. So, and there are rentals, big houses out there. We've talked to some of the people that own them, and they would be very happy to have a group of seniors in there, especially if Radical Rest Homes is around to deal with the problems and do the management of the building. And we're not going to give up. That's our big thing. I don't care how many years it takes, I'm getting this damn thing off the ground. You know, I'm living alone now, and I've always lived with other people. And living alone, I find as I age and don't have as much work to do, it's too quiet. It's too, there's something, you need more socialness going on. Now, if you're in a NORC and, like, you can see other people and stuff like that. But I think there is something to say for sharing space as well as we age. And so it may not be for everybody. I don't expect, Radical Rest Homes to be what every senior wants. But there is a social and a support system in a Radical Rest Home that you don't find in your own apartment, or even if you have neighbors. So Radical Rest Homes, this is my whole thing, helps everybody to reimagine aging. Even if you don't want to go into a Radical Rest Homes, it allows you to think about what can we do that's better than what we have now. So that's Radical Rest Homes.
Well, thank you very much for your very interesting presentations. I know it raises a lot of questions, but I think it's a lot of food for thought, and that's how things get started and up and running. And so I hope you enjoyed the presentations. I want to thank everyone for being here today. We hope you will share with someone else what you have learned here today. On behalf of all of us, a huge thank you to Jen and Janet. Everyone have a great day, and we'll see you soon.